I'm just going to go ahead and introduce our speaker for the evening. Dr. Pamela Smith, MD, MPH, MS, spent her first 20 years of practice as an emergency room physician with the Detroit Medical Center, and then 24 years as an anti-aging functional medicine specialist. She is a diplomat of the board of the American Academy of Anti-Aging Physicians and is an internationally known speaker and author for the subject of metabolic, anti-aging, and personalized medicine. She also holds a master's in public health degree, along with a master's degree in metabolic and nutritional medicine. She has been featured on CNN, PBS, and other television networks, and has been interviewed in numerous consumer magazines, and has 2 of her own radio shows. Wow. Dr. Smith was one of the featured physicians on the PBS series, The Embrace of Aging, as well as the online medical series, Awakening from Alzheimer's and Regain Your Brain. Dr. Pamela Smith is currently the director of the Center for Personalized Medicine and the founder of the Fellowship in Anti-Aging, Regenerative, and Functional Medicine. Dr. Smith was recently the co-director of Master's Program in Metabolic and Nutritional Medicine at the Morsani College of Medicine, University of South Florida. She is the author of many best-selling books, some of which include What You Must Know About Women's Hormones, Why You Can't Lose Weight, What You Must Know About Memory Loss and How to Stop It, What You Must Know About Thyroid Disorders. Her new book, What You Must Know About Vitamins, Minerals, Herbs, and So Much More, was released this year. Her newest book, How to Maximize Your Immune System, will be released this fall. Dr. Smith's new television special will air this year on PBS and CNN. So thank you and enjoy.
Thank you so much. Good evening, everybody. Yes, the Morsani College of Medicine at USF sounds really good right now because it was 91 in Tampa today. Oh, we're going to spend some time in maximizing your immune system. So we're going to look at different ways here because stress and anxiety negatively impact your immune system. Alcohol does, lack of sleep, an unhealthy diet, an unhealthy gut, dehydration, lack of exercise, and of course, cigarette smoking. So what can we do about stress management? I mean, who isn't stressed in today's world? I'd love to go to sidewalk sales, at least I used to before this COVID craziness started. And I was literally at a sidewalk sale in front of a bookstore, and I love to read, and there was this great book called Dog Play. And I love both cats and dogs. And these are from the Quips Dog Play. The actual quotations come from the book along with the pictures. I mean, look at this guy. Isn't he cute? I mean, truly. Don't microanalyze every breeze that comes your way. If you're hypervigilant, and things are never perfect for you, it's really hard to normalize cortisol, the stress hormone. Cortisol is the only hormone in the body that increases with age. It's made by the adrenals. When you're stressed, you go crazy working 365, 24/7, you overbook. Everything causes cortisol not to be normal. So I love this poem from the poet Carl Sandburg. Time is the coin of your life. It is the only coin you have. Only you can determine how it will be spent. Be careful lest you let other people spend it for you. Another great looking dog. Again, look at those eyes. Life is not a busy contest. It should not be. Because what does cortisol do? It balances blood sugar. It helps with weight control. It is your immune response. Bone turnover rate, stress reaction, sleep, protein synthesis. It decreases inflammation. Almost any disease you can think of, including COVID, after the age of 45 is inflammatory in nature. Cortisol balances the other hormones. When you're first stressed, cortisol elevates. When you've been stressed for a long time, it becomes too low. You actually have to have cortisol to live. If you stop making cortisol, you die in 7 days. So it's hugely important. So what drives up cortisol? Chronic stress, depression, synthetic hormones like progestin, sodium depletion, high prolactin, inflammation, Cushing's disease, which is a disease of high cortisol, and being overweight. What lowers it where it's too low? Long-term stress, disease Addison's, opioid use, believe it or not, chronic marijuana use, Accutane, and steroid use. So one study actually showed that as many as 75 to 90% of visits to primary care doctors are stress related. It does compromise your immune system. Chronic stress has been shown to contribute to accelerated aging and premature death in medical trials. Another great looking guy, consider fresh air God's Prozac. We do need to get out and breathe fresh air, because if cortisol remains elevated, your immune system is compromised. It breaks down bone structure. You can get osteoporosis and osteopenia. You get fatigue, irritability. You crave sugar when you stay stressed. Shakiness between meals, confusion. Your memory's not as sharp, even if you're 24, if you stay stressed. That's why they tell you in college, if you go to take an examination, what do? Relax. Low energy, night sweats, binge eating, your blood pressure, cholesterol, blood sugar, triglycerides all go up when you're stressed. More increase in infections, thin skin, easy bruising, muscle weakness, weight gain around the middle, sleep disturbances, even your thyroid gland that sits in your neck that regulates the whole body doesn't work as well if you stay stressed. So tip number 1 is to manage stress. Stress reduction techniques, prayer, meditation, Tai Chi, yoga, Qigong, exercise, massage, breathing techniques, acupuncture, a multivitamin, adaptogenic herbs, calming herbs. All of those things help with stress, because everybody has stress. It's about managing it. The next one's kind of interesting, alcohol. Moderation is the key to health. I do want to comment on alcohol from the viewpoint that it is liquid sugar. So when you imbibe a little bit, remember a glass of wine, beer, etc. is literally sugar. So it's kind of like a half of a candy bar. Sugar compromises your immune system. So again, moderation. Lack of exercise or lack of sleep is next. Optimal hours of sleep are 6 to 8 hours a night. So go to bed before 11 o'clock and do not get up before 5 a.m. It sounds crazy to say that, oh, I want to get up at 4:30 and do exercise before I have to start my work day. That's actually not healthy, because it changes the circadian rhythm in your body. When it's changed, the circadian rhythm is a natural internal process that regulates the sleep-wake cycle. And a medical study showed that a disturbance of your circadian rhythm increases the incidence of psychological diseases like depression. It increases the risk of other problems like cancer, heart disease, diabetes, and yes, it does compromise your immune system. You make a hormone called melatonin, and almost everybody knows that this regulates sleep. What you may not know is that melatonin also builds your immune system. Melatonin's been shown to regulate blood pressure and blood sugar. Low levels increase your risk of developing heart disease, stroke, Parkinson's, and cognitive decline. If you're going to take more than 1 milligram a day, it should be measured by a saliva test, because you can take too much. Too much melatonin actually lowers serotonin, your happy neurotransmitter. But believe it or not, melatonin is so important for your immune system that we now use it to treat stage 4 breast cancer with or without chemo. So how do you get deficient in melatonin? Alcohol abuse, caffeine. Is it bad to drink caffeine? For most people, 1 to 2 cups of coffee or tea or iced tea are fine. When you go to the 3rd cup, then it does compromise your body. Electromagnetic fields. In fact, this crazy computer I'm sitting in front of right now can lower melatonin. Tobacco and the aging process does too. For some people, as they age, this important hormone declines. So if you're not sleeping well, let's look at melatonin. If you feel your immune system's compromised, we can build it by having the right of melatonin in your body. Unhealthy diet. We're going to look at this from 2 perspectives. Nobody eats perfect, but sugar does compromise your immune system. The consumption of 20 teaspoons of sugar per day can reduce your immune system by up to 50%. Sugar does suppress the immune system, from Nancy Appleton's work. She's written several good books, Suicide by Sugar and Lick the Sugar Habit. The average American consumes anywhere between 150 to 170 pounds of refined sugars in 12 months. A century ago, the average American consumed 4 pounds per year. So there's been a big difference. Men eat a little less than women. The approximately 13% of adults' total caloric intake comes directly from sugar. Refined sugars have absolutely no really medical benefit. There's no vitamins, no minerals. They're pretty much just carbs. So what does sugar do? Let's give you some ideas. Everybody gets cancer. Everybody. 5, 6, 7 times in your life. If you have a healthy immune system, it kills off the cancer cells. What feeds it? Feeds cancer, sugar, and stress. This is from Patrick Quillen's work. Sugar can affect how pretty and youthful your skin looks. It can promote tooth decay. It can cause weight gain. It can increase the risk of bowel disease like ulcerative colitis and Crohn's. It can cause arthritis. It can lead to candidiasis or yeast infections. Sugar can cause gallstones. It increases your risk of heart disease, kidney stones. If you have MS, it exacerbates it. It can cause insulin resistance and lead to diabetes. This one I thought was very interesting. Sugar can decrease growth hormone, the hormone that keeps you young. It can increase your blood pressure. It can change the structure of your proteins. It can impair DNA. It can negatively impact your eyesight by causing diabetic retinopathy. It increases your risk of cataracts as well. It can cause free radical production, can cause a fatty liver. I think you're getting the idea, right? It can increase fluid retention, can cause constipation. It decreases your ability for the tendons to repair themselves. It can cause an increase in delta, alpha, and theta waves in your brain, which compromises your memory. It can cause depression. It drives up blood sugar, increases fermentation of the bacteria in your colon. It causes platelet stickiness or adhesion. What does that mean? It can cause blood clots. There are hidden sugars. Yes, alcohol. One of the ones I never realized was ketchup. Ketchup is about 50% sugar. Many luncheon meats, there's sugar inside of it, so read the package. Breadings commonly contain sugar, salad dressings, and restaurants. Many restaurants will add sugar to their hamburger to prevent shrinkage, so it makes the hamburger actually look bigger. You are what you eat. And again, nobody eats perfect. But what are some signs of poor digestion? I mean, what does that really mean? Perfect digestion is 2 bowel movements a day. So if you have less than 1, that's not healthy, because your gut, your bowel, your GI tract is an organ of detoxification. If you see undigested food in your stools, that's poor digestion. Foul-smelling stools. If you feel better, if you don't eat, that's poor digestion. Chronic indigestion after eating, poor sleeping habits, waking up feeling tired, if you're cold for no reason, if you're depressed for no reason, if you frequently burp, pass gas, or feel bloated, if you feel stressed and you don't have a cause. Other signs of poor digestion, a need to loosen your belt after eating, even though overeating has not occurred. An increase in your pulse within 15 minutes after eating. Chronically coated tongue. So what are signs of optimal digestion? 2 bowel movements a day. No undigested food in the stools. The stools don't smell. You feel good after you eat and several hours afterwards. You sleep well. You wake up feel rested. Warm extremities. Good energy level throughout the day. No extreme food cravings. You feel better when you exercise. You don't have frequent mood swings, shakiness, anxiety, depression without a reason. People can have inflammatory diseases of their gut, like dysbiosis, which is quite common. This is an imbalance of intestinal bacteria. So how do you know if you have dysbiosis? Well, you certainly want to be tested for it, or at least consider having it if you have chronic nausea, you have belching, bloating, heartburn. It is not normal to have heartburn. So many people think, oh, I'll just go take an antacid. You're supposed to have some acid in your gut. Abdominal pain, cramping and abdominal distension, depression, anxiety, altered bowel function, constipation, diarrhea, cramps and spasms, increase in mucus production, gas, halitosis. But it's not just in your gut. If you have dysbiosis, you can have symptoms that occur outside your GI tract. Arthralgias, muscle aches and pains, anxiety. It's amazing to me how many people, if you fix their gut, their anxiety goes away. It also amazes me that their brain is sharper. Depression, fatigue, fever of unknown origin, frequent urination, malaise, muscle pains, heart racing or palpitations, phlebitis, pruritus, which is itching, skin rashes, seizures, vasculitis. These can all be because your gut is not healthy. Well, how does this happen? One thing, you put things in that don't belong. Overuse of antacids. Antacids should be used for most people very rarely unless you have a precancerous lesion in your esophagus. Poor nutrition, SAD, the standard American diet, is just that, sad. Free radical production, stress can cause your gut not to be healthy. Alcohol abuse, non-steroidals, meaning those kind of medications that you take like Motrin, etc. Antibiotic use long-term can cause dysbiosis. Viruses can. Believe it or not having enough acid. 40% of people who have reflux, 40% actually need acid instead of an antacid. Decreased digestive enzymes, not enough bile. Food allergies are a common cause of problem with your gut. And of course, if you travel a lot, it's easier to have a gut problem. If you're exposed to high altitudes, yeast infections. The patient I saw just before I started this webinar tonight kept having chronic issues with her gut and chronic infections in her bladder. And it turned out that she had yeast, lectins. So what happens if your gut's not healthy? You have a loss of good bacteria. You don't make the perfect vitamins like vitamins A, D, E, and K, the fat-soluble vitamins. You don't hold on. Biotin for your hair and nails is made in the gut. Serotonin, your happy neurotransmitter, is made in the gut. If you have dysbiosis, you don't detoxify well, loss of chemical and antibiotic protection, overgrowth of bad bacteria, which leads to leaky gut syndrome. That way toxins will re-enter your bloodstream. You can even get your medication twice. There's a lot of conditions that are associated with leaky gut. I put them in alphabetical order. You notice the first slide, we only got to see. That's how many things can be related to your gut not being healthy, including, of course, a compromised immune system, an increase in infections. But all of these things. So we do want to help your gut be healthy. We want to do what's lovingly called the 5R program of total gut restoration. Remove the problem, replace, repopulate, repair, rebalance the body. And we can help you do that. It's a wonderful program of fixing the gut to build your immune system. It's one of my favorite things of the 7 things we can do. How about dehydration? Make sure you drink enough water. There's no substitute for water. If you have normal kidney function, you should drink at least 1/2 your body weight in ounces every day. Of course, that is considering that you have normal kidney function. Is not just it, you have to have normal heart function and liver function too. Exercise. This is the one I personally have a hard time with. Honestly, I don't get the high a lot of you tonight get from exercise. I exercise for 2 reasons. 1, to maintain memory. The second reason is to make sure my immune system is healthy. Exercise is working out, doubling your pulse for 20 minutes, 3 to 4 times a week. If you exercise more than that, it's considered aggressive exercising, and then we need to help you with more nutrients. So if you aggressively exercise at any age, whether you're 24, 50, or 80, your body gets depleted in other nutrients. If you're over the age of 50, your body needs additional nutrients anyway for exercise. If you've not been exercising, then please don't go out tonight and start an exercise program tomorrow. If you're over 40, see your doctor for an EKG before you start an exercise program. And then, of course, smoking. You would think everybody now would know that cigarette smoking can lead to different diseases, leads to heart disease, leads to an increase in macular degeneration and vision loss, can lead to lung disease. But if you smoke, it compromises your immune system. So if you smoke, work on a smoking cessation program and try and stop smoking. So there's a lot of things that we can look at in the body. The good news is we can actually help balance. We can go back through all of these things. Every one of these things on here that look at compromising your immune system, all of them are 100% fixable. So let's look again at what these are. Stress and anxiety, we can work on stress. Come on into Wellness Pharmacy and they can do a saliva test and see what your cortisol is. Alcohol is fine to drink, just don't drink too much. Moderation is the key to health. Lack of sleep. You need good sleep hygiene to be healthy. An unhealthy diet with too much sugar and a gut that doesn't work. At Wellness Pharmacy, we have a great gut health program of total gut restoration where we can help you have a healthy gut and you can have a good immune system, enough serotonin, biotin for your hair and nails, etc. Drink more water as long as you are healthy. Try and exercise, and if you smoke, quit smoking. So 7 ways to harm your immune system. The good news is you can fix this in every single person. So you can have a healthy gut, you can have a healthy immune system. I'd like to go ahead and open it up to questions.
hate to start for, I mean, I feel uncomfortable, but I'm going to if no one else is. This is great. So I am in my mid-50s going through all kinds of hormonal things. Long story short, you heard I mentioned I had chronic fatigue syndrome for the last 20 years. I understand the leaky gut part of this. Still need to work on it, but my biggest component out of the 7 that I struggle with is sleep. I mean, really struggle to the point where I can take all kinds of medications for sleep and not sleep. I am a true insomniac. Now, that may be health related, and I'm curious. I take melatonin, and I take melatonin on my own, amounts that I've never been checked. So you recommend a screening for melatonin levels for myself?
Absolutely. Make sure that as a woman you make progesterone. Progesterone regulates sleep. Cortisol not being normal is a problem. I do recommend that people don't sit in front of a computer. When we're done tonight, I will be shutting off my computer, because when you sit in front of this, it does compromise melatonin. Same thing if you sit on your cell phone. The biggest thing I think that surprised me about sleep was to fix the gut. Have you had your gut looked at?
Years ago, I went through various tests. At that time, I didn't have real high levels of some of the bad stuff that they were looking for. I'm fairly good with diet, not perfect. I could do better with sugar, and I realize I need to. You just said something, though, about the melatonin, and then there was something you said, and it hit me. I'll have lost it, because that is one of my problems. But yeah, I don't know where it was. Oh, I don't use a lot of the EMF thing. I'm all about that. So I'm very careful about that kind of exposure as well. Don't do much with alcohol. Just have true insomnia kind of. Oh, progesterone. I'm 55, been hormonally very unstable. No, my gyno doesn't believe in checking those levels at any level. So I have no idea where I am, only that I haven't menstruated for 14 months. And then I started in with a cycle of bleeding, and we found I had polyps. So I was bleeding after 14 months of no bleeding. And I just had a DNC. So I feel like hormone replacement therapy would help me with that, but then I'm afraid of hormone replacement therapy because.
Don't be afraid of hormone replacement. That's what we can measure. Because the number one reason that people have insomnia, okay, are females that are 55 is stress. The number 2 reason is low progesterone.
That's what I thought.
100% of women have low progesterone when they're 55. I'm 66. Do I take progesterone? I do. Do I take estrogen? Yes. Do I have a family history of breast cancer? I do. But I'm not worried about getting cancer because my hormones are balanced. My gut's healthy. I don't smoke. I honestly don't drink alcohol at all, because the new studies that came out this year show that women that drink alcohol, it does increase their risk of breast cancer. So don't be afraid of hormones. And talk to the people at Wellness Pharmacy about doing a saliva test. And measuring hormones. Talk to them about doing a gut health test and getting your gut healthy too, because both of those things will help with sleep.
That's fantastic. I didn't know that was within wellness that I could do that. So I will be talking to the girls about that. Okay, I really appreciate the hormone replacement therapy idea. I was wondering, I really am a type A anyhow before all of this. So I'd like to bring things down a little bit. Thank you.
Oh, thank you for asking the question.
Very grateful. Thank you.
Other questions? You don't have to ask them. You can put them in the chat box too. Mary Ann, do you have a few things you'd like to say tonight?
No, that's putting me on the spot. You're making my cortisol go up. I think it is just like Dr. Smith said, it's about the balance. I mean, we know that it's hard to live it with the lifestyle that we all have, but I'm 52 years old and I've learned the hard way that sleep is important.
Yeah.
I used to laugh and say that I will sleep when I'm dead, and I would go and push. And I was one of those that got up at 4 o'clock in the morning because I felt like I had to do my exercise. And I've learned the hard way, and I've worked here over 20 years, and it took me a while myself to figure it out that you do have to do all of these things because everything plays on one another, and hormones is very important. And we do work with a lot of ladies and men here at Wellness with hormone replacement and the balance. And we work with a lot of patients who have family history, as Dr. Smith mentioned. And it is just about measuring those levels, reporting back your symptoms that you're having, and just working closely with your physician and the pharmacist. We have 15 pharmacists here that work closely with our patients. We very much believe in the triad relationship, which is the patient, the physician, and the pharmacist. We work as the three components, and they have equally important responsibilities. You as a patient needs to tell us, your concerns, just as you said, Pamela, you're concerned about hormone replacement, you're afraid.
Mm-hmm.
We need to be able to get you to that level that you feel comfortable. And starting slow. Anything like this that we do, we start slow. We start low and go slow, I should say. And the hormones will always need to replace hormones in a low fashion. We don't ever want to have a patient, female or male, on more hormones than are necessary, because we will put you in a position that you'll start having symptoms. Even symptoms of low estrogen can be manifested if we have too much hormone on board. So it's very important that you as the patient tell us, your symptoms and how you're feeling, your concerns. We work really closely with your physician because your physician plays the part of, we need the prescription. It's because it's customized specifically for you. So I know, Pamela, you mentioned your physician may not be on board.
Yeah, my primary will be great, but my gyno, not so much. So.
Okay. Well, we'll be glad to educate them as well with anything that they need to know. But we do truly work with each patient individually. In the art of what we do, compounding, we can tweak, change, make the medications in many different dosage forms specific to you. And as we go into the therapy and add things or change, we have ability to tweak things easily, so that you're not just using some kind of medication that's off the shelf in a cookie cutter fashion. Very customized specifically for you. So I've learned, I've lived it myself as a female, a mother of two, worked full time, and will work full time probably and, for a very long time. I've lived it. I've kind of walked where you guys probably are. I've pushed myself too much. I haven't taken care of myself. I haven't eaten well. Haven't done all these things. So I've walked this journey, and I'd be glad to help walk through it with any of you. CBD. That's the question. Georgia, can you read the question?
Yes, Dr. Smith, they had a question about, can you comment on the use of CBD oil to help with sleep?
There's really no test to say if CBD is going to work. For some people, it works great. For other people, it doesn't. And it's about half and half. So there's no test saying that it's going to work for you. People can certainly try it and see if it does, but it may or may not work. It's about a 50-50. Mm-hmm.
Are there any other questions?
There are questions in the chat box. Does anybody send any in?
That was the question.
Okay, perfect.
This is all going to be available again for us to, I would love to actually share this with my physician. I think she's one that would actually watch this again. And
sure, yes, I will send out an email with the recording on it, so you guys will have access to this.
That's
and
great.
If you have any follow-up questions, you can send them to me, and I will send them to whoever needs to see the question as well.
That's great, Georgia. Thank you.
Yeah, no problem.
Well, thank you all very much for attending tonight. And I thank Wellness Pharmacy for facilitating all of this. And remember, there are several things that can harm your immune system. We certainly can help you fix all of this. So please email, pick up the phone. We're happy to help you. Have a great night, everybody.
Oh, we have one more question that just came into the chat. She asked, what do you think about probiotic gummies? Are they helpful at all?
Well, there's different kinds of probiotics. My personal favorite is called Megaspore Biotic because it's actually a spore. And it's new technology. It does get into the body really, really well. I can't comment on the gummy because obviously there's several kinds of gummies. If you're looking at a gummy, just make sure it doesn't have sugar added because that would kind of defeat the purpose. But Megaspore Biotic is awesome. I do know they do carry it at Wellness. It really does get into the body. It doesn't have to be refrigerated. It's good for 5 years. And I actually take that one myself. It's fabulous.
Thank you for that. We've got a comment in the chat. Thank you for the kind words about Wellness Pharmacy. That was very sweet.
Yeah, this has been fantastic.
All righty, well, thank you, Dr. Smith. We definitely appreciate it. This has been very informative, and I'm excited to have this recorded so we can share with more people.
Thank you so much. Thank you, everybody, and thank you for all who attended. It really is the patient, the pharmacist, and the practitioner. That triad is so important. Have a good night, everyone.
Thank you.
Thank you.
Thank you.